Hi friends, this video I am going to talk about dry eyes. Dry eyes is considered to be one of the most common problems that we ophthalmologists are seeing not only in India but in the world over. Dry eyes is caused mainly because of our lifestyle. We are a lot on the screen these days. But of course, one of the most common causes of dry eyes that is being discussed today is something called as Meibomian gland disease or MGD. Now, Meibomian glands are these oil glands. They are present on the lid margin, both upper and lower lid, and these glands are responsible to secrete oil onto the tear film, which prevents evaporation of the tear film, leading to less of dry eye symptoms. Obviously, when these glands do not function, there will be less oil on the tear film will evaporate faster and you will get symptoms of dry eyes. What are the symptoms of dry eyes? Symptoms of dry eyes are burning, itching, stinging, eyes becoming red, excessive tearing, not able to wear your contact lenses which you were comfortable doing for so many years. These are all symptoms of dry eyes, and once you have these symptoms, it becomes extremely uncomfortable for the individual and they are seeking treatment which many a time do not really help. So what happens today in a dry eye clinic? Usually when patient walks into a dry eye clinic, we give the patient a questionnaire. The questionnaire will give us an idea about what is the severity of dry eyes. Based on the severity of dry eyes, we decide whether we want to prescribe certain eye drops, whether we want to prescribe some investigations, whether we want to do certain tests, and what treatments we want to offer. Treatments can range from eye drops to even therapies these days. The therapies involve heating up of the eyelids and certain massages on the eyelids, which will actually help the Meibomian glands function normally again. I will talk to you before I end about 7 things that you can do to prevent dryness or to reduce the symptoms of dry eyes. The first is to blink your eyes frequently and consciously. When we all look at screens today, we forget to blink. Our blink rate reduces significantly and this leads to dryness. Number 2 is whenever you are on a monitor or on a screen, to give yourself a break every 30 minutes. So, after every 30 minutes, look far away for 30 seconds. By far away I mean somewhere outside a window, some building far away. What that does is that will actually reduce the eye strain that you have. Number 3 is to hydrate yourself well and obviously drink less tea and coffee in the office hours. Number 4 is to use lubricants as prescribed by your eye doctor. Many of these lubricants are even available over the counter. Number 5 is to reduce smoking or stop smoking ideally. Number 6 is to increase the height of your chair so that when you are looking at your monitor, you should be looking slightly downwards when you are looking at the monitor. You can't be slouched in your chair and looking at your monitor in an up gaze, because what that does is then you have to open your eyes wide and it gives a larger surface area for the evaporation of the tear film. And finally, do not sit directly under an AC blast. You cannot have wind blowing across your face or a draft of air blowing across your face, which would again hasten the process of dryness. So these are the 7 things that you can do to reduce feeling of dry eyes, and I do hope after watching this video you get a better idea of this very common condition of dry eyes. We have other videos on our YouTube channel related to eye care. Thank you for watching.